The way I think of traditional medicine is the ancestral wisdom and teachings that promote overall wellness and well-being.
It's our cultural practices that promote the best healing. We kind of looked at the strengths of this organization that had already been in existence for 45 years, and we knew that we had to center every single thing that we do on culture. We do blessings and cultural assessments, talking circles, drumming circle, and sweat lodge. We also have a tremendous array of plant medicines.
They say laughter is good medicine. Being connected with people, having a sense of belonging, that's traditional medicine.
Some people have the ability to go home, right, and do ceremony or to access their healers, but not everybody does in an urban setting. What we've tried to do with our network of practitioners is to build out a network that has representation from as many different tribal communities as we possibly can. When we implemented this, we set ourselves a meager goal. We want to have 340 traditional Indian medicine encounters a month. In that first year, we had 1,700 encounters per month. And now we're at 3,400 encounters per month. So we had to expand and grow quickly. That told us we were doing the right thing.
There's a lot of traditional medicines that help people, and we have relatives come back and confirm to us that this is really helping. Seattle Indian Health Board is a forerunner in innovation in terms of integrating traditional medicine across the board.
There's a psychologist out of UCLA, his name is Dan Dickerson, and he has found drumming is actually just as effective as AA in regards to sobriety. They have cultural protocols, right? They have to be sober to be on that drum. You have to follow a spiritual way to be able to participate. Say, for example, somebody is getting medically assisted treatment, mental health support, they're seeing their primary care doctor, and they're also participating in the drum circle, they have the best chances of entering a life of sobriety.
One of the challenges that we're constantly facing is the tension between institutional, organizational demands and requirements and traditional, cultural practices and ways of being.
It's one of the things that I find most frustrating, because now here we're in this capitalistic environment where we need money to survive. And our traditional ways of taking care of our healers have become dismantled by that a bit.
The innovations here at Seattle Indian Health Board has been to roll out this pilot billing project to see if we can actually get traditional medicine reimbursed through billing. That is not being done anywhere else.
Western systems are really defined by coding systems, especially in Medicaid. And so we actually had to define codes so that we could bill for traditional medicine practices. When you have a service that is actually billable service, right, where you get a reimbursement, that third-party revenue that you generate can be utilized in a variety of different ways.
We've been establishing a credentialing process for how one can credential traditional practitioners. We've incorporated into our electronic health records, which traditional medicine had never previously been.
When you walk into our organization, you're going to smell medicine in the air. Sometimes it's sweetgrass, sometimes it's sage, sometimes it's cedar. That's going to be your first experience.
Nutrition services and medical services, behavioral health, substance use, all the way through dental. Traditional medicine is right there at the core, and I don't know if anybody else is doing it.
Oftentimes we will measure success based upon monetary value. This is not that. That's one of the reasons I think this is incredibly innovative, is that we've been able to utilize these Western systems, but make them work for our people.
Interest in traditional medicine services is increasing. Seattle Indian Health Board is definitely at the forefront of providing care that is equitable and incorporates traditional practices.
What we're doing is showing that it can be done. If we can create this system and show that it works, it can really change Indian country. We just have to be open to change.